Okay, so we'll go ahead and get started. I'm just going to share my screen with you. And while I'm getting that pulled up, I do want to mention that we have had a member that's been made up so that we could show member information without showing PHI. And so we do have a made-up member. And then also I wanted to call out that when I am sharing my screen, it will look different than your screen. So just keep that in mind, and I'll try and call out the difference between the screens. So I'll start with the easiest stuff first. We're going to go ahead and we'll do an adjustment, void, and reprocess, and then we'll get into adjustment with the TPL. So when you're logging into PRISM, you're going to want to log in with the claims processor provider profile. This will allow you to do adjustments. It will allow you to void, reprocess. It will also allow you to submit claims and also to inquire about the claims. Once you've logged in as the claims processor provider, you're going to go to your claims tab, and then you're going to scroll down and do your adjust void claim. And it will bring you to this page. When you log on to the adjust void, you're only going to have one option, and it's going to be to enter in the TCN. And I did have some providers ask what to do to prepare for the training today. And I did mention if they had some claims that they wanted to adjust or void, they could bring it. If that is the case, and I am going too fast, please just let me know. So after you've entered in the TCN, you're going to click on Go, and that's going to bring your claim up. In order to be able to adjust, void, or reprocess a claim, it has to have a claim status of paid, and it has to have a paid cycle date. If you come into the adjust void option and you enter in your TCN and it does not pull up, the first thing that I would do is make sure that there are no spaces prior to the TCN or following the TCN, as the system is picky with the spaces. If it is still not showing up, then I would go to your claims inquiry just to verify that it does have a claim status of paid and does have a claim cycle paid date. So once you have found your claim in the adjust void section, you're going to click on your TCN hyperlink. And that's going to bring us into our header detail page. Here you can make adjustments to any field that is in white. If it is grayed out, then you are not able to change that information. So you can change the patient control number, your place of service. You cannot change the warrant number. You can't change the date of birth, and so forth. So next we're going to go to our show menu, and we're going to go to our service line, and that can either be reached by doing your show menu down to your service line list, or there is an icon just under the show menu that allows you to click on, and it takes you right to your service line. So the first thing that we're going to do is we are going to add another claim line. And in order to do that, in the bottom right-hand corner, you'll see that we have add, delete, and cancel. We're just going to click on the add button. And again here, if it is a white field, you can enter in information. If it is grayed out, we will not be able to enter information into there. Your rendering provider, taxonomy, your supervising provider, your authorization number, place of service. If it is different than the header information, then go ahead and enter it here. If it is the same information that was entered at header, then it is not required at line. Go ahead and enter in our date of service. And then we'll do a procedure code, and we're just going to mimic one of the codes that's already on the claim. The oral cavity and tooth number will be required depending on the procedure code, if it requires calling out the tooth number or the oral cavity. Our submitted charges for this example is going to be 100. Our billed units is going to be 1. And then I'm just going to verify that all of the asterisk fields have been filled in. And it looks like we have 4. We have the service date, procedure, charges, and the units. So we'll go ahead and we'll click on save in that bottom right-hand corner. And then we're going to click on cancel. And that takes us back to our service line. And now you can see we have 3 lines. 01 is line 1, TCN ending in 02 is line 2, TCN ending in 03 is line 3. To delete a line, you would simply click on the box next to the one that you would like to delete. And then down in the bottom right-hand corner, you click on the delete button. It's going to ask you if you're sure you want to delete that line. And now we have 2 lines. When adding and deleting the lines, make sure that you're paying attention to the submitted charges. The submitted charges do need to match the total amount billed, which is that header. Okay, so we're going to go to our bottom right-hand corner. We're going to click on cancel. And our line was 250 and our total fee here at header is 250. Once all of the information has been adjusted, whether it's a line or taking away a line, you would simply click on the adjust button in the bottom right-hand corner. And in this pop-up screen, using the drop-down, you'll only have one option. And for this example, it will be the provider-initiated adjustment is what you will select. The discovery date is auto-populated. You can leave it as is. And then in the comments, you would put the reason for the adjustment. For this example, you can state added a 3rd line or, deleted a 3rd line. And you can call out the procedure codes and why it was done. Once that information is added, you would just click on OK. And then that claim will be released for adjudication. For this example, we're not going to click on OK. We're just going to click cancel to get back out. But once you do click on OK, it does bring you back to the adjustment void screen. So I'll walk you through on how to, does somebody have a question?
Are you going to be discussing if deleting a line is involved with a refund?
So can you explain a little bit more on that? Because I think I understand. I just want to make sure I understand.
So there's 2 situations. So if we had originally billed a CPT code that you'd processed payment on, and now we're no longer billing out that CPT code, if we go in and we void out that line, will it prompt Utah Medicaid to take that payment back?
Yes. So
Okay.
anytime you do an adjustment, it's going to create 2 new TCNs. It's going to take the paid TCN and it's going to change it from claim status paid to claim status adjust. Because remember, you can only adjust claims that are in that paid status, right, with the paid cycle. So your paid claim is now going to become your adjusted claim. The system is then going to create 2 new claims, and this is for the adjusted claims. It's going to create one, which will be your new TCN or your claim number, which will tell you if it is paid or denied, and that will give you an RA number, paid cycle, so forth. The second TCN it is going to create is a credited claim. So when you look in your claim status column, it will say credited. And you'll notice, just as an example, this number 250, instead of being 250, it would have a negative in front of the 250, indicating that that is going to go back to Medicaid. And both your new TCN and your credited TCN will start with a 4. If your claim starts with a 3, it has been submitted electronically. If your claim starts with a 2, it has been submitted through the PRISM portal. If it starts with a 4, it has been adjusted, reprocessed, something has been changed to that claim. And I hope that answered your question. Go ahead.
So just a follow-up question, and if this is later on in the training, just let me know. What if we have a situation where Medicare B is primary, they paid a specific amount and only say left $2 to Medicaid to pay, but Medicaid then came in overpaid on that? How would we prompt to do a partial refund on the claim?
So there is an issue with Medicaid paying more than what was left to the patient responsibility, and that is still being worked on. So at this time, I would just take a note of that so that when that update has been made, you can go ahead and reprocess those claims. And we will be walking through how to reprocess a claim in just a minute.
Okay, and with that, how long has this been a known issue with Utah Medicaid, and is there an expected resolution date?
What do you think, Brad? Do you mind taking that one for us?
Yeah. To answer your question, I'm not sure exactly how long it's been a known issue. I know it's been discussed several times, and right now we do not have a for sure timeline on when that will be resolved. But as that gets worked out, we will definitely be able to spread the word and make sure everybody knows.
I do have a question
Okay.
on that.
Sorry, go ahead.
So we were told that that issue dated back to July of 2024 and that there was a fix put in place January 22nd. Is that fix not correct?
I think, and without getting into it too much, I would say we did have some fixes that went in that brought to light some new issues, and so they were not totally resolved now.
Okay, and is Medicaid going to be reprocessing those claims that they paid incorrectly?
I think it will. That one would be a question for somebody a little bit higher than me. I wish I had a for sure answer for you, but I don't at this moment.
Okay. Thank you.
But I do sympathize with all of you, and we'll make sure that everybody knows, and we'll have a process in place for when it is time to reprocess those claims, what the avenue is for that.
Okay. If you have any say to your higher ups, we would want an expectation that Medicaid would take care of those claims on their end as it was a Medicaid issue, rather than expecting the providers to go back in and hand process all of those
Sure.
claims.
You betcha.
Thank you.
Will you be accepting paper checks for those refunds in the meantime, like you used to prior to you guys utilizing PRISM?
So I know that they are trying to stay away from the paper checks and try and do the reprocessing of the claims. Did you have something more, Veronica?
I believe in the past they used to allow about 90 days for that payment to remain with Medicaid or for that credit to remain. And if it passed the 90 days and providers didn't submit claims to clear out that credit, then they could submit the adjusted payment to Medicaid. And there were instructions on the Medicaid website through a form on how to do that. I'm not sure if that's still the case. I can go in and do the research right now if you'd like. I don't know if you know, Elena, about the adjusted amounts or.
Last I heard, we weren't accepting checks.
Right. So what we can do is if you have a question about the overpayments, or if you would like more information about the overpayments, if you could just say overpayments and then enter your email address, we'll go ahead and we'll get those copied, and then we can do some research and find out that information for sure for you and give you a little bit more direct answers. So yeah, if you're interested in learning more about the overpayments or when that update goes into effect, if you'll just put overpayment and then your email address in the chat in this meeting, then we can go ahead and follow up with you.
I can also speak to that as well, because we had that issue. Refund checks, actual checks, are not accepted for 3 years. And I say that because I was the one that had to get the form updated, because the form had incorrect information on it, and that anything that is over 3 years would have to go to UOIG. But Medicaid itself would not accept any checks for claims that were within a 3-year time frame.
You are correct. I'm looking at the form. In the provider form directory, it's called payment adjustment, and it does say 3 years. Credit balances resulting from adjusting claims less than 3 years old will generally be satisfied by offsetting future claims until the credit balance reaches 0. So after the 3 years is when that payment is expected to be made to Medicaid. But like Alina and Becca said, I'm not sure at where it stands right now with those paper checks. But it does provide detailed instructions on how to do that on the form directory.
I just wanted to make sure, I need to learn how to add an NDC or update an NDC number on a CPT code. Will you be going over that, or is that part of this portion?
I had not planned on going over that. However, when I do get to the professional one, if you will remind me, I will point out where to do that NDC. So we are going to go ahead and we're going to go in to our dental, and we're going to do a void. When you log into PRISM, make sure that you're logging in using your claims processor provider profile. When you use the claims processor provider profile, you'll then come in to your claims tab. You'll scroll down and select adjust void claim. And when you click on that, it brings you to this screen. Again, you'll only have the option to enter in a TCN. So you'll enter in your TCN, and then you click on Go. If your TCN is not found, make sure you're checking the spaces before and after, and make sure it does have the claim status of paid and does have a paid cycle date. We'll go ahead and we'll click on the TCN hyperlink, which brings us to the header detail page. Again, anything that's in white you can change. Anything that is in gray will remain the same. And to void a claim, we're going to go down in the bottom right-hand corner, and we're just going to click on the button Void. And that's going to bring up the window, which allows us to use the drop-down. For the providers, it says provider initiated void, and that is what you'll select. There's only one option. Then you'll leave the discovery date alone. That's auto-populated to the current date. Then you'll enter in your comments as to why that claim was void. And I do recommend that you take advantage of entering in those comments so that you know later if something comes up or if there's a question that you know why that claim was either voided, adjust, or reprocessed. And I can show you in a little bit where to find the comments that you leave in this section so that you can refer to them later. After we click on avoid and we do our provider initiated void and enter in our comments, once you click on OK, then that claim will be released for adjudication. And for today's example, I'm just going to back out of the claim. After you click on the OK after your comments, it does bring you back to this page. Okay, we'll go ahead and continue. Next, I'll walk you through on how to reprocess a claim. So again, you're going to log into PRISM using the claims processor profile. You'll go to your claims tab, scroll down and select adjust void claims, and that will bring you to this page. You can enter in your TCN and then click go. And then click on your TCN hyperlink. And a reprocess claim is a claim that you are not making any changes to. You don't need to change any information that line. You don't need to change any information that header. You're just sending it back through to reprocess. At that point, you would come down to the bottom right and you would just click on save. And then you would click on adjust. And again, your option would be provider initiated adjustment. You would leave to the discovery date as today's date, and then enter in the comments as to why you are reprocessing the claim. And then you would click OK. And after you click OK, then the claim is released for adjudication. We're just going to click cancel and head back out to our main screen. Any questions so far? Go ahead.
Hi. So if a claim has already processed, what would be the reason to have it reprocessed? Is it because you overpaid or didn't pay on all the lines correctly?
So yes, that would be a really
Okay.
good example. So if a claim was overpaid and you needed to reprocess it, then yes, you could come in here and you could just go in and reprocess it. If
Okay.
there is a code that wasn't paying before and it is now, or vice versa, you can just come in here and just do that reprocess.
Okay. And then on the previous example you just gave us, the one where you actually just void the whole claim out, when you do that, does PRISM create a new claim number for the voided claim?
Yes, so what it does when you void a claim, instead of creating 2 additional TCNs, it only creates the one, which is the claim status of credited.
Perfect. Okay. Awesome. Thank you.
You are welcome. So I'm going to show you where to find the notes, the comments that you have left. If you go into your Inquire Claims, you can do your TCN. We'll click on Go, and then we're going to click on the TCN hyperlink. And then in the top right-hand corner, we're going to click on our Show menu. We're going to use our drop-down list. We're going to go to Claim Notes. And this is where the notes would be as to why the claim was adjusted, voided, reprocessed, and so forth. So if you needed to refer to the comments that you had entered in, you'd be able to find them in the claim under Claim Notes. So that is adjusting, voiding, and reprocessing a claim. And now we'll walk through how to do how to adjust a claim with the primary insurance. So again, you would log into PRISM and you would use the profile claims processor provider profile, and you come to your claims tab, scroll down and click on your adjust void claims. You would only have the option for TCN, so you won't need to use the filter as I am. You'd need to enter in the claim that you want to adjust and click go or press enter. Then you'd click on your TCN hyperlink, which would bring you to your header details. Okay, so we're going to adjust our primary insurance information, and that's done by going to the show menu, scrolling down to other payers information. Now, there is a defect, and so with primary insurance and adjusting, so you cannot click on the ones that are linked to the header TCN or your line TCNs and edit them. The way to bypass being able to adjust your primary insurance on a claim is by clicking on the box next to the TCN, to the word TCN. And then you're going to click on delete. And normally I recommend taking a screenshot of what you see so that you know the information that's already in here. So we're going to go ahead and click on delete. Yes, we are sure we want to delete this, so we're going to click OK. And as you can see, all of that primary insurance is now been deleted. So to add it back in, you're going to use your TCN field, and you're going to use the drop down. And if you notice, we do have the first one that ends in 00. That is going to be our header TCN. The primary insurance for our header TCN always needs to be entered in first, or we will get an error. The TCN ending in 01 is for line 1. The TCN ending in 02 is for line 2. So we'll go ahead and enter in our header primary insurance information. And this is based off of the primary EOB that you have received. We're going to enter in the payer ID number. We're going to enter in the payer name. The claim filing indicator, this does get a little tricky. There are members that have Medicare through a commercial insurance, and the commercial insurance is being listed under the payer name, which is fine, but the Medicare needs to be called out in the claim filing indicator. So even though you might have Molina or Select Health under the payer name, because the member has Medicare, you would need to select either Medicare A or Medicare B, depending on the services that were rendered. In this example, they did have Medicare through Medicare, and we are going to select Medicare. In this example, we're selecting Medicare Part B. Okay, we'll go ahead and we'll enter in our group information. Policy number is not required, but I do have that, so we'll go ahead and add it. The amount paid, total amount paid at header. For this example, we're putting 0. The patient responsibility is going to be primary, and we're selecting primary because this is the primary insurance information that we are adding. And the remittance date is not required. And then we have the adjustment summary. If there is no patient responsibility left for the claim when you're looking at your primary EOB, Medicaid cannot pay more than 0. There has to be a patient responsibility amount left on your primary EOB, and then it has to be added onto the claim before Medicaid will pay on that claim. So I'm going to start on the right-hand side with my reason group code, and I'm going to select contractual, CO for contractual, and my reason code is going to be 45 for this example. And the total amount for this contractual is for the whole claim is going to be 252 cents. On the primary EOB, there is another contractual, so I'm going to click on Add Another. And then I'm going to select my contractual, and the code for this one is 253. And the total amount paid for the whole claim for this contractual is 0.97. There is also a patient responsibility for this claim. I'm going to do Add Another. I'm going to select PR for patient responsibility. The reason code is 2. The primary insurance header information has been added. Again, this is the information for the whole claim. Once that's been added and is correct, we're just going to click on Add Update. And now that is populated up here under the Other Payers section. Okay, we'll go ahead and add our primary insurance to line 1. So we're just going to come to our drop down, select line 1. And if we come to our payer ID, we'll use the drop down and we're going to select the payer 1. And what that does is that autofills everything except for the amounts in that are in the required field. So we'll click on payer 1. Now all of our required fields except for the amounts are filled in. So this is for line 1, primary paid 0 for line 1. And then we have a contractual for line 1, and that is our 45 code. And the amount that they paid for line 1 for our CO 45 is the 149.98. We also had the second contractual, so we're going to click on Add Another, use our drop down, select contractual, and this code was the 253. And the amount for this contractual on line 1 was 0.8. We're going to click on Add Another. We're going to add our patient responsibility. And this is a 2. And on your primary EOB, if it says PRO2, just leave that 0 off. The system doesn't like the reason code starting with a 0. The total amount for this line is actually $10 even. I'm just going to review everything. Everything looks good, so I'm going to click on Add Update. And now my line 1 is also populated up here with my header. So we'll go ahead and we'll enter in for line 2. Scroll down and select line 2. Select our payer ID, which will fill in those required fields, except for the amount, and we'll go ahead and we'll enter in 0. And for line 2, we do have the contractual 45, so we'll add our CO and 45. And the amount for line 2 is going to be our 5054. And then we have our second contractual on line 2. We're going to scroll and select our CO and our 253. And the amount for line 2 is going to be 0.17. Everything looks good. So I'm going to click on Add Update. And now we're showing that we have line 1, 2, and header. So next, what we're going to do is we're going to verify our amounts. And the way we do that is we're going to add our line totals to see if they equal our header totals. So we're going to start with our CO 45. So we're going to take our CO 45 for line 1, which is 149.98. We're going to add that to our CO 45 for line 2, which is our 50.54. And that comes to $200.52. And if we look at our contractual 45 at header, it is 252. So our CO 45's balance. So now we're going to add our CO 253s for line 1 and 2 together. So for line 1, it is 0.8. We're going to add that to our CO 253 on line 2, which is 0.17. That comes to 97 cents. And if we look at our CO 253, it also is 97 cents. So our CO 253 also balances. Next, we're going to take our PR2 for line 1 and line 2, and we'll add those together. And 10 plus 0 is 10, and at header, it is 10. So our claim, the lines balance to our header. Okay? So from here, we're going to go ahead and we're going to click on Save to save all of our information. Yes?
If the lines were not balanced, does it give you an error?
Right here. So if your lines are not balanced to what the header is, and your header is not balanced to your submitted charges, you will get this error. Or it will say TPL unbalanced, something with unbalanced. This one gives us a not equal to. So we're going to go ahead and close this if there is not any other questions. Okay. So unfortunately, this does fall in not being able to edit the information. So we will need to click on the TCN, the box next to the word TCN, and we're going to click on delete. And I am going to go through this a little bit faster. If I go too fast, please let me know. So we're going to start with our header. We're going to enter in our payer ID, the payer name, the claim filing. We are going to select the MB, the group, policy number, the amount paid is going to be $47.51. The responsibility is our primary. And then we're going to add our contractuals and our patient responsibilities. We have contractual, CO 45, and that amount for header is the 252. We're going to add another for our contractual, 253, and that is our 97 cents. We're going to add another, which is our patient responsibility, so our PR2, and that is going to be our $10 even. Okay, excuse me. So now we have all of our header information. So we're going to go ahead and click on Add Update. Again, that's populating now up under the Other Payer section. We're going to do line 1. Click on the payer ID, payer 1 autofills. The amount paid is 0 for line 1. We have our CO 45. And the amount paid in our CO45 for line 1 is our $149.98. We're going to click on add another for our CO253. And the total amount for line 1 under our CO253 is 0.8. Add another. We're going to do patient responsibility, our PR2. And that total amount is $10 even. And we're going to click on add update. Now we're going to go and we're going to do line 2. Payer ID is going to do autofill if we select the payer 1. The amount paid for line 2 is 0. We're going to do our CO45. And that's going to be our 5054. Add another. We're going to do our CO253. And that is going to be 0.17. And then we did not have a patient responsibility here, so we're going to click on add update. Okay. Now we're going to go ahead and we're going to add our information together. So again, both of the CO45s, so 149.98 plus the 5054 equals our 252. Then we're going to do our CO253, which is 0.8 plus line 2, which is 0.17, and that equals the 97. And then our patient for line 1 to our patient line 2 equals the 10. And then we're going to come over to our amount paid. And we're going to add line 1 amount paid to line 2 amount paid. And it does not equal our header amount paid. So we are going to need to change that. If you need to make a change to a line after you have deleted the initial information, you can click next to the line that you want to adjust or to fix and click edit. This only works on the lines and it only works after the initial information is deleted. So we're going to click on edit. And if you look down here, our information has populated. We're going to change the amount paid from 0 to our 4751. And the system does not like the dollar amount sign, so we're just going to go down and we're going to delete the dollar amount sign, the dollar sign. Once that's done and updated, we're just going to click on add update. Now if we add line 1 to line 2, it does match to our header. Okay, so that is your line balancing to your header information. Now we're going to take the header information and balance it to the claim. So we're going to add patient responsibility at header to our CO253 at header, which is 97 cents. We're going to add that to our CO45 at header, which is our 252 cents. And then we're going to add that to the amount paid, which is the 4751. And that should equal the total submitted charges. And for this bill, it is the 259. So what we're going to do is we're going to go ahead and click on save because everything is balanced. Okay. And then we're going to click on the bottom cancel button in that bottom right-hand corner. Okay, so we're going to click on cancel. And if we look at the amount that we added together for our header, it is the 259, and this is our submitted charges for 259. Okay. To adjust the NDC, you would need to go to the line. So we would go either use the icon under the show menu for our adjust service lines. We would go, or you could go to your show menu and scroll down to service line list. You would go into the line. You wouldn't need to click on the box, you just click on the TCN. So we're going to go into line 1, and we know it's line 1 because it ends in the 01. Then you're going to go to your show menu, and you're going to select drug information. And this is where you can enter your NDC, quantity, units, and so forth. Once that information is entered, you would click on Save. So I'm just going to go ahead and click on Cancel, since I'm not adding that NDC. And up here you can see I'm on the service line details, so I'm going to click Cancel again in that bottom right-hand corner. And again, you can see I'm still on the service line. So in the bottom right-hand corner, I'm going to click on Cancel again, which brings me back to my header. Okay, so we're going to go ahead and we're going to save. And then we're going to click on Adjust. And in the window, we're going to use the drop-down menu, and we're going to select Provider Initiated Adjustment. The discovery date is going to auto-populate. You can enter in comments, whatever you want, like add a TPL at line, entered in NDC, whatever the reason is for the adjustment. And then you would click on OK. And once this OK is selected, it will be released for adjudication. And we're just going to click Cancel for this example. Yes?
How do you enter? This is one of the problems that we're having are when payments are not line specific, such as a TPL PIP payment, $3,000. It's not line specific. It's just a flat payment for the entire claim.
Okay. So we are finding that we have an issue with that, and we are working with those that are involved. It actually goes across like EDI as well as doing DDE. And they are working on trying to find out what that is. Brad, did you have any more information with that? Like what triggers that and what they're working on?
I don't. I know it's a technical issue that they are trying to make adjustments to in our system, but I don't have any update on that.
Have you tried submitting like through the clearinghouse so it comes in electronically?
Yes. We've submitted them several times. I've actually done adjustments with you, and those were also denied.
Okay. So yeah, that is something that they're working on. And would you put your name in the chat so that I remember to reach out to you? Because I do believe I have some information on yours, if I'm remembering right.
Yeah, we have communicated just today even. So.
Okay, I just want to make sure.
Yeah, no problem.
For you. Okay,
thank
you. You're welcome.
So when we submit claims electronically through our clearinghouse, and we have a few that keep denying, stating that the coordination of benefits is not showing, but we show it's attached. Is there a glitch in your system that's not locating the coordination of benefits?
No. So Medicaid no longer requires the EOB to be attached to the claim. So the system does not go out and read attachments. Anything that is attached to a claim needs to be manually reviewed. So unless your claim has a denial for a manual review, anything that you have attached to it is not going to be looked at. And
Okay.
that's why we're going through the process of trying to help providers add that primary insurance either through DDE or through the clearinghouse, how to adjust it if needs be, and so forth, because the EOBs attached to the claims are not being looked at by the system.
Okay. So when we get a CO22 denial and it's requesting the prime EOB, we need to manually fix it through PRISM?
That is correct. You can submit it through your clearinghouse. Are you
Mhm.
using a clearinghouse?
Yes.
Okay. You can submit that information through your clearinghouse. But yes, that's what it's asking for. Is it's asking for like your CAS segments and your AMT segments, like it wants the specific primary insurance payer information loops in
Okay.
your, yeah.
So do you know what kind of loop error number it gives you?
Are you asking what loop to enter in the primary insurance?
Yeah.
Not off the top of my head. I
Okay.
could give you some numbers, but I would be
Mhm.
guessing. I want to
Okay.
say at header, I do believe it's loop 2030 is the loop for header, but I would have to verify that for you. If you wanted to put your email into the chat
Sure.
and then just put loops for primary insurance, I can make sure we get that information to you.
Awesome. Thank you.
You are welcome. Did anybody else have questions?
Hi, this is Shanna here. I have questions on the credits due to the issues that were from April. Anyway, the overpayments that they are paying as a secondary. What can we do with those in the meantime?
I would recommend keeping track of them so that you know which ones are being affected by the issue and which ones will need to be reprocessed. That way, if Medicaid does end up doing those reprocesses for you, you can submit that spreadsheet and you will already have your information together.
Typically with an overpayment or a credit to Medicaid, we have so much time to refund. And then if we don't refund in time, there's an extra fee that's attached. Are those going to be waived since there's a system issue?
I can't say for sure yes, but I do
Okay.
know that there have been leniencies with the
Mhm.
issues that we are having with
Okay.
the providers because we know it is an issue on our end.
Mhm.
There has been able to have some leniency approved to be able to help the providers. But as
Okay.
far as that direct question, I am unsure.
Okay. No worries. Just checking. Thank you.
Absolutely. And then real quick for the EDI loop, when you're submitting the primary insurance at header, it is going to be 2320. And for line, it's going to be loop 2430. Are there any questions?
We have claims that have crossed over and paid as primary.
Okay.
What do we do with those?
So if you can see them because of the billing NPI, you should be able to go in and adjust them as long as they have a claim status of paid and a paid cycle date.
Okay. Thank you.
You are welcome. So I just want to make sure that I'm clear with that. So Medicare sent in the claim, correct? And so it's showing in the system as a crossover. But you sent it to Medicare because they were listed as primary, correct?
Yes.
Okay, so yes, you can go in if they have that claim status of paid and that paid cycle date. you should be able to copy the TCN and take that into the claims tab, go to your adjust void and enter that TCN. And then you should be able to go in and make the adjustments. You'd go to your show menu and then your other payer insurance information.
I was just wondering why Medicare, did Medicare send them the information incorrectly?
So there are some issues with claims with primary insurance paying more than the allowable, right? More than, right, what's left to the patient responsibility. And I don't know everything that goes into that. I don't know like the claim types and different things like that. If you are being paid incorrectly, you can call our customer service to find out if it is related to that, right? The other thing is when you are adjusting a claim, if Medicare has only entered in that insurance at header, it would actually depend on how your EOB came in. So if your EOB from Medicare came in and it's only showing the header TPL and nothing is listed at the line, then I do believe that falls into one of our issues we're having. Is that correct, Brad?
Yes, that's correct.
If there are no other questions, I want to thank everybody for coming out and supporting me with this training. And hopefully we were able to share some good information with you. And hopefully we can see you in the future with other trainings that we have coming up. And I hope you guys have a great day.
Thank you, Becca.
Thank you,
so much
Becca.
for coming. You bet. Thank you.
Mhm.